Okay, hello. My name is Michelle Herrera, and this is my PowerPoint presentation for Nursing 370 Health Promotion and Patient Education Strategies with voiceover. So here we go. I did mine on managing chronic heart failure. So how does the mismanagement of chronic heart failure affect the community? More than 6 million Americans are living with heart failure, and over 900,000 new cases are diagnosed each year. Heart failure is one of the most common reasons for hospital admissions among those 65 years and older. Heart disease and stroke, along with other cardiovascular disease, are among the most widespread and costly health problem facing the nation today, and they account for approximately $320 billion in healthcare expenditures and related expenses annually. So not only is the mismanagement of CHF causing a financial burden to the community, but mismanagement of this disease increases the mortality rate of people with it. This project of teaching African American adults with CHF will aid in the Healthy People 2020 goal of reducing hospitalizations of older adults with heart failure as the principal diagnosis. To assess the learning needs of this group, I will use listening sessions to learn about the community's perspectives on chronic heart failure. This will help me get a sense of what these community members know and feel about their disease, as well as resources, barriers, and possible solutions. To promote health within the community and this specific group of people, I will assess support systems, their access to medications, transportation to primary care follow-up visits, and knowledge about their disease. The priority needs of this group is preventing readmission to the hospital for CHF exacerbations. The health promotion model that I will use for this group of people within the community is Dorothea Orum's self-care theory. This model was selected for this case because one of the major assumptions of this model is that a person's knowledge of potential health problems is necessary for promoting self-care behaviors. Therefore, by educating this population of the potential risks associated with their disease, I can help make them help them take better care of themselves. Additionally, people should be self-reliant and responsible for their own care. Teaching them about chronic heart failure and how to manage it will prepare them for a long-term management of their disease and prevent rehospitalization. The health education plan has a goal to decrease the risk of CHF exacerbations. There are 3 behavioral objectives that I want to focus on within this group. The first is weight management and having them take their weight at the same time each day. This will give them a good indication of any type of fluid overload or changes in their weight so that they can be a little bit more proactive. The second is medication management. I want this group to be compliant with all of their prescription medications. And the third behavioral objective will be identifying acceptable foods to eat and which foods that they should be avoiding. If these behavioral objectives are being met, then the educational plan for this community will be successful. Research within the literature. Patient support by a doctor and a dedicated multidisciplinary team involving a comprehensive pre-discharge review and follow-up through a home visit or specialist CHF clinic is recommended to prevent clinical deterioration. Follow-up care is extremely important. Medication management. Angiotensin converting enzyme inhibitors, also commonly known as ACE inhibitors, are the therapy of choice for heart failure patients and should be used in all cases unless there are contraindications or clear evidence of intolerance. All other therapies are used mainly for symptom relief. So ACE inhibitors being used as a medication management is very important, and want to make sure that all of the patients are taking their medications as scheduled. Regular physical exercise corrects endothelial dysfunction and improves exercise capacity in patients with chronic heart failure. So it's very important for this group of people to have a regular exercise regimen that they do and continue to do. Were the goals of this program met? The outcomes to measure are determined by the goals of the program. Therefore, we will evaluate weight management, medication management, and exercise in the participants. We want to evaluate if the behavior change was a result of the program to determine if the program was successful. If the program is effective, this affects global measurements and health promotion. Moving forward, to maintain regular physical activities, one of our goals. We always want this group of people to be aware of the sodium content in the food they're eating, and we want them to take their medications every day. Ways that they can maintain this goal are to keep a diary of the weight and the food of their weight every day and the food they eat. They need to go to their follow-up doctor's visits. Involving the family in the new healthy lifestyle is important, and maintaining a support group, especially one specific for chronic heart failure, because it is very common and people with this disease are not alone. Here is a list of references for my presentation. Thank you very much for your time.